Hi puppies and welcome to the channel Tanya's Polyglot. In today's lesson we are going to learn medical vocabulary. If you want to learn new vocabulary,
Welcome
please
to
stay.
Language Adventure with Tanya. Imagine exploring the world through its languages. Picture yourself strolling past the Eiffel Tower, diving into the rich history of Germany, or savoring the vibrant culture of Spain. Each language opens a door to new experiences, friendships, and understanding. Whether you're mastering English, dancing to Korean rhythms, or savoring French cuisine, every word you learn is a step on this exciting journey. Let's embark on this adventure together and unlock the beauty of communication across the globe.
So let's begin. We have the objective to equip medical interpreters with the terminology and phrases required for accurate and professional interpretation in medical settings. We have key topics: human anatomy. We have the organs like the heart, the lungs, the liver, the kidney, the stomach, the body parts, the arm, the leg, the back, the abdomen, the system circulatory, respiratory, and digestive, and we have common symptoms like pain, swelling, fever, nausea, dizziness, shortness of breath, and then we have the vital signs, right? Blood pressure, pulse, temperature, oxygen saturation, common disease conditions like diabetes, hypertension, asthma, and cancer. And we have the emergency care, stroke, cardiac arrest, trauma, shock, urgent phrases. Call 911. Are you allergic to any medication? Chronic illness management, medication adherence, insulin use, dialysis. Pediatrics, we have vaccines, developmental, milestones, ear infections. Then we have obstetric, gynecology, prenatal care, labor, postpartum. Then we have mental health, depression, anxiety, psychosis, therapy, and in surgery we have anesthesia, pre-op, post-op, and now let's see some common medical phrases. We have the patient to doctor. Have pain here? I feel dizzy. I have trouble breathing. Doctor to patient. Do you have any allergies? On a scale of 1 to 10, how severe is the pain? We need to run some tests. Interpreting challenges. False cognates words that sound similar but have different meanings. Cultural differences in expressing symptoms or concerns. In that part, be careful, guys, especially if you are interpreting like calls from Latin America, right? People invent every word to any part of the body or pain, right? So be careful. Now let's see some categories of disease. We have general disease, right? Like flu, cold, fever, chickenpox, measles, mumps, and tuberculosis. Then we have chronic disease like diabetes type 1 and type 2, hypertension, high blood pressure, asthma, chronic, obstructive pulmonary, um, arthritis. Then we have osteoporosis. Then we have Parkinson's, and then we have others. Then we have infectious disease like pneumonia, hepatitis A, B, and C. Then we have HB, AIDS. Then we have malaria, COVID-19. Then we have a strep throat and meningitis. So now let's see more categories. We have cardiovascular disease like heart attack, a stroke, congestive heart failure, arthritis. Then we have neurological disease like epilepsy. Then we have Alzheimer. Then we have disease, migraine, brain tumor. Then we have the cancers, the types of cancers like breast cancer, lung cancer, colon cancer, leukemia, skin cancer, and melanoma. So now let's see other categories. We have here digestive disorders like arthritis, ulcers. Then we have irritable bowel syndrome (BS), Crohn's disease, celiac disease, and hernia. Then we have endocrine and metabolic disorders like obesity and so on, right? Then we have skin conditions like eczema, acne, and so on. Is your homework, guys, to write and hear and practice the pronunciation of these words. In that way, you will memorize them. Then we have mental health disorders like depression, anxiety disorder, bipolar disorder, schizophrenia, post-traumatic stress and disorder. Then we have the pediatric conditions like croup, hand, foot, and mouth disease, whooping cough, ear infections, and so on. Then we have allergies and immune disorders like food allergies, seasonal allergies, lupus, erythematosus, and rheumatoid arthritis. Then we have the reproductive health issues like endometriosis, pelvic inflammatory disease, and so on. Guys, is your homework to study each word and pronunciation. You should investigate the pronunciation for you to memorize them better. So now let's see some general questions that maybe you will hear if you are a medical interpreter, right? For example, when the doctor says, "What brings you in today?" and the patient will say, "Can you this?" Or well, the doctor, right? "What brings you in today? Can you describe your symptoms? When did your symptoms start? Have your symptoms gotten better, worse, or stayed the same? Is there anything that makes your symptoms better or worse?" These kind of questions is the ones that the doctor could ask to the patient. We have here pain as statement. Do you have any pain? Where does it hurt? Can you rate your pain on a scale from 1 to 10? Is the pain constant or doesn't it come and go? What kind of pain is it? Sharp, dull, throbbing? And so now let's see some questions for medical history. Have you had this problem before? Do you have any chronic illnesses or medical conditions? Have you had any surgeries in the past? Are you taking any medications or supplements? Do you have any allergies to medication, foods, or other substances? This kind of question, guys, is the ones that the doctor could ask. If you pay attention in these sentences or questions, we made a mix of all the topics that I've been teaching you in this time that I create this YouTube channel. And I hope that you enjoyed every lesson. And if you see here, I am trying to picture out why it's important that you know every topic that I've been teaching in this channel. So I hope that you could identify that we use the present perfect, the simple present, and so on, right? The verb be. And if you see here, it's necessary to use all the grammatical topics that we previously. Then we have the family history. Does anyone in your family have a history of similar problems? Are there any hereditary conditions in your family, for example, diabetes, heart disease, and cancer? Then we have lifestyle questions. Do you smoke? If so, how much? Do you drink alcohol? How often? Do you use any recreational drugs? How often do you exercise? Then we And have a some specific specific symptoms related questions. For fever or infection, have you been feeling hot or cold? Have you had chills or night sweats? Do you have a cough, sore throat, or runny nose? For gastrointestinal issues, we have issues. Do you have nausea, vomiting, or diarrhea? Have you noticed any changes in your bowel movements? Do you have any abdominal pain or bloating, right? Then we have here for cardiovascular symptoms. Do you feel chest pain or pressure? Do you have swelling in your legs or feet? Have you experienced any palpitations or irregular heartbeats? In women's health, let's see now. When was your last menstrual period? Are you pregnant or could you be pregnant? Do you have any issues with your menstrual cycle? For example, irregular periods, heavy bleeding. Then we have mental health. Have you been feeling emotionally? Have you been feeling depressed or anxious? Have you had any trouble sleeping or eating? Do you have thoughts of harming yourself or others? For follow up or treatment plans, have you been taking your prescribed medications? Have you had any side effects from your medications? Did the treatment I prescribed last time help? Do you have any concerns about the treatment plan? So now, guys, after all that information and vocabulary that I give you, I will try to picture out for you one like role play between the doctor and the patient, right? She says, "Good morning. What brings you in today?" And he says, "Good morning, doctor. I've been feeling chest pain for the past 2 days." He's describing how he felt. Then we have, is the pain Then we have, is the pain constant, or does it come and go? And he says, it comes and goes, especially when I take deep breaths. So now, guys, after all that information that I give you, we will make an activity time. Don't be afraid. So now, guys, after all that information that I give you, we will make this exercise. Complete the following dialogue by filling in the missing words. Doctor, good. What do today? Patient, good morning. Doctor, I've been feeling pain for the past. Doctor, is the pain or it does? And patient, it, and especially when I take breaths. Pay attention in here, guys. You have to give sense to the sentences. It's not necessary that you will add a verb or that you will add something else like vocabulary. It can be any word possible here. So be careful with that and try to complete one sentence. Doctor, do you have any breathing or other symptoms like or? Patient, yes, sometimes I feel off, but I don't. And so on, guys. So thank you guys. Don't forget to give a like and subscribe.